I think we're seeing a huge demand from our members, customers, patients across the world for what they perceive to be a more personalised way of receiving healthcare and health information. The idea of being able to choose where and when you access healthcare. Do you have to go somewhere? Can you receive it in your own home? Do you have a choice of who you see and how you interact and so on? And then, of course, as you said, increasingly looking for treatments that are particularly targeted at themselves and their specific condition.
It's joining the dots for that patient in order to access the healthcare that they need. I think healthcare systems are confusing for doctors, let alone patients. So if we can make that journey easier, that personalisation, that journey for the patient, that will lead to a better outcome.
We really want to work on prevention of diseases, but also early diagnosis and early intervention of diseases, because at the current system, we wait way too late and we treat people with end-stage disease. So that, I think, is probably the key element of creating much more sustainable healthcare systems.
Being a general practitioner in the UK, I think we absolutely stripped our capability to do prevention and public health. That is the thing that we were trained in. We were trained to give you continuity. We were trained to understand your family circumstances. We were trained on situational judgment. That is all personalisations. How do you train the workforce? How do you make time in the clinical pathway? How do you fund backfill so that clinicians have got capacity to absorb innovation? How do you bring scientists together with clinicians? How do you bring the patient voice into the conversation? And so forth.